Hello, my name is Robert Hatfield, and my pediatric condition is cerebral palsy. Cerebral palsy is caused by the damage or disease during or shortly after birth, resulting in brain damage, neurological, and muscular deficits. Common causes can include lack of oxygen or deprivation of oxygen, brain bleeds or intracranial hemorrhage, meningitis, chronic alcohol abuse during pregnancy. It can also be a genetic factor, endocrine or metabolic disorders. The prognosis of cerebral palsy is dependent on the severity of the brain injury and location where it occurs, and can be categorized into four different types. Spastic CP is the most common and will result in flexor and extensor imbalances, typically in lower and upper extremities. Dyskinetic, involving abnormal muscle tone, coordination, and movement control, which can affect all upper extremities and can also affect the tongue and the mouth, causing issues to swallow or to speak. Atactic is categorized by balance and coordination problems, and whenever we have multiple of either spastic, diakinetic, or ataxic, it would be considered mixed cerebral palsy. Characteristics of cerebral palsy is either high or low muscle tones. Having a low muscle tone will be hypotonia, and having a high muscle tone will be hypertonia. Other symptoms commonly associated with cerebral palsy is hearing or vision issues, movement and coordination issues. Since it does affect the brain, they have a higher likelihood of epilepsy, which they may be taking medication for. They can also have behavioral issues, postural or gait abnormalities, um, since they do have tightness in lower extremities or their muscles, so they might walk a little different. They also can have digestion issues, bladder and bowel movements, uh, which can be constipation or urinary incontinence, and also speech issues. As stated before, cerebral palsy is caused by brain damage shortly or during birth. Damage to the brain can have significant impact on development. The most prominent and visual sign would be physical development in motor and coordination. A child with CP can have delayed developmental milestones, including rolling over, sitting upright, crawling, and it can impact their ability to walk or run due to a different gait pattern. Another developmental impact would be cognitive and intellectual development, as some clients, depending on severity of their injury, since it does affect the brain, they can have attention, memory, or limited ability to process information. Um, and another one would be speech and language. As stated before, there is some involuntary movements in some limbs and can happen within the mouth. So speech can be delayed in some cases. So it can impact speech, control, swallowing, and can hinder abilities for socialization and language development. Areas of challenge with clients with CP can include ADL such as dressing, drinking and eating, toileting due to incontinence and digestive issues, bathing and hygiene, um, as well as sitting upright and managing medications. Other things might be educational participation and social participation. There is three major special considerations for occupational therapy with somebody with CP. Um, they are going to need to have a lot of adaptive equipment, possible dressing aids, utensils to eat, postural support chairs, or mobility aids or braces. Um, so education in those areas are probably going to be necessary for full participation. In addition, collaboration between speech therapists and physical therapists, since there is potential deficits in speech and swallowing. Speech therapists may be involved, and physical therapists may be involved because to build up strength and to manage pain. Um, Other potential considerations would be surgical procedures. It is not uncommon for CP patients to undergo certain surgeries, um, and just being sure you know safety precautions that are laid out by the primary care physician, having a dialogue between them to ensure that they can heal and properly recover and not cause additional harm. And here are my references. Thank you so much.